If you're wondering what a rheumatology visit is like, or if you want to know how to prepare for your first rheumatology visit, then this video is for you. So you recently got referred by your doctor, who may be a primary care doctor or another specialty, to a rheumatologist, and you're wondering, what can I expect from the first visit? You're probably scared, you're probably nervous, you've probably read a lot of scary things on the internet regarding rheumatic diseases, but is a rheumatology visit that scary? What should you expect and how should you prepare? So let's start with what to expect. Rheumatology is a specialty that is very comprehensive. Not only do rheumatologists focus on joint pain, but they also focus on systemic autoimmune diseases. Yes, you've probably heard of rheumatoid arthritis, but rheumatologists also treat lupus, it can treat vasculitis, dermatomyositis, and these diseases don't always have to have joint pain. Rheumatologists treat a lot of connective tissue diseases. Because we treat so many different connective tissue diseases, our questions are very thorough and comprehensive. Well, at least they're supposed to be. So our questions can range from head to toe, and it's one of the very few specialties that requires a very strong internal medicine background in order to be very successful in this field. Because our specialty thinks about disease in other specialties, and the symptoms can overlap with other specialties as well because of the myriad of symptoms that our diseases present with. So when you first get to the office, your rheumatologist is going to ask you why you're there. What symptom are you exactly coming with? They want to know your main symptoms. From there, they will most likely ask you about your symptoms. For example, let's say you tell your doctor, your rheumatologist, that your main symptom is joint pain. They're gonna ask you a series of questions about your joint pain. For example, where is your joint pain? When did it start? Do you have morning stiffness? If you do, how long is it? Does your pain get better with rest or movement? Do you wake up at night from pain? Also, they're probably gonna ask you whether you notice swelling in your joints. And do you ever have trouble taking off your wedding ring or your rings in general? Because these questions for joint pain will help a rheumatologist distinguish whether your joint pain is just wear and tear, or if it's something more systemic and if it's inflammatory. We're looking for inflammatory joint pain in rheumatology, so we're looking for swelling, warmth, and redness. In addition to questions about joint pain, your doctor can also ask you questions from head to toe. Do you have hair loss? What pattern is your hair loss? Does your hair come back when you get hair loss? Do you have any symptoms involving your eye? Does your eye ever get red and painful? Because that can indicate to us that you may have uveitis or some other eye problem. And questions also involve the mouth. Do you ever get ulcers in the mouth or nose? Do you ever cough up blood? Do you ever have nosebleeds? Other questions may include, do you get rashes? What's the pattern of your rash? Do you ever get red in the sun easily within 10 to 15 minutes? Do you have hearing problems? Do you ever get chest pain or shortness of breath at all? Have you noticed that you're more tired lately? And do your fingers ever turn blue, red, or white that worsens in the cold weather? That can indicate to us that you may have something called Raynaud's phenomenon, and that can be associated with some of our systemic autoimmune diseases. When I ask my patients these questions, the purpose of it is to make sure my patient doesn't have any other diseases that could be a possibility here. Yes, my patient may have said, my main symptom is joint pain, but they could forget or be discounting other symptoms that are really important. So I'm ruling out other diseases in my head while I am asking these questions. I'm making sure my patient doesn't have lupus, scleroderma, dermatomyositis, and any other diseases and other specialties that could be their main diagnosis. So after the rheumatologist asks these questions from head to toe, the rheumatologist will then proceed to a physical exam. Actually, prior to a physical exam, they're gonna ask you about your family history, your surgical history, and your social history. Some of the things they're gonna make sure is that you don't have any other autoimmune disease running in your family, because that could be a clue that you may actually have something going on, because autoimmune diseases do have genetics playing a role here. But you don't always have to have anyone in the family with disease to have the diseases, because part of it is the environment. So moving on to the physical exam, So the physical exam can include a comprehensive joint exam. So if you have a lot of joint pain, especially in your hands or feet, your rheumatologist is going to examine those very closely. What they're feeling for is sponginess in the joints to make sure there's no fluid going on. Sometimes rheumatologists will use an ultrasound during the visit to scan the hands or other joints to make sure there's no fluid around the joints that is subtle. If a rheumatologist doesn't use an ultrasound, then they could potentially use an MRI later down the road to see whether there's fluid around the joints, but that's not always needed. Sometimes we can feel the joints or the swelling is so obvious that you don't need an ultrasound or an MRI or any other machine to help figure out whether there's fluid around the joints. Because fluid around the joints is telling us that it could be inflammatory. So in addition to a joint exam, which all rheumatologists should do, the rheumatologist could potentially listen to your lungs and heart as well. If a patient presenting to me with a lot of shortness of breath or signs of shortness of breath, or the disease has a high tendency to involve the lungs, then I will listen to the lungs more closely. What we're listening for are something called crackles or other abnormal sounds that could potentially indicate lung problem. And also, we're listening to the heart for arrhythmias. We're listening for abnormal heartbeats or abnormal rhythms. We're also looking for rashes on your skin. So if a patient comes to me for joint pain, for example, or other diseases that might indicate skin involvement, then I will look at the skin very closely. For example, if a patient has arthritis coming to my office, I will make sure the patient doesn't have psoriasis. If a patient does have psoriasis, that could indicate that the joint pain could be psoriatic arthritis. So we put patterns together in rheumatology. And there are patterns of rashes that involve the eyes, the face, and the hands as well. So there are so many things we do in rheumatology during a physical exam. Sometimes it can be very quick, like a minute, if there's not too much going on, or it could take a couple minutes because we want to make sure nothing else is going on. And after the physical exam is done, then your doctor will talk to you about your diagnosis and the plan. So the plan could include medications. So sometimes it might involve steroids. The rheumatologist may include imaging exams such as x-rays of the joints or CT scan of the lungs, depending on what they're thinking about. And also, labs will be obtained as well. 99% of the time, the rheumatologist will obtain labs unless there's a very straightforward case such as osteoarthritis, which they might not need labs for. So these medications in rheumatology could be quite scary for patients, especially if you hear the side effects. So definitely do your research to learn more about these medications, and don't be afraid to ask your rheumatologist questions about their diagnosis and their medications in the lab, because it can be quite confusing and complicated. Okay, let's move on to part 2. How do you prepare for a rheumatology visit, whether it's your first or second visit? Or third visit as well. On your first visit, the best way to prepare for a rheumatology visit is to get your symptoms all mapped out on the timeline. If you're gonna come to a rheumatologist with, let's say, 5 years of charts, 10 years of information, and you see multiple doctors, including multiple rheumatologists, the rheumatologist would love to see previous labs, previous medications you've been on, and other specialist notes and doctor's notes, because it's so important for them to figure out what has happened in your history, why you're coming to a doctor after 10 years. And because these diseases can be so complicated, it's very helpful to get them all typed out or written out. Some of my patients that have come to me in the past that have seen maybe 5 years of doctors, 10 years of doctors, they have their symptoms all written out on a Word document. They've emailed it to my office prior to the visit. So that is very helpful for me. So I just look down on their list and I just confirm everything they've written. So you have this joint pain back 5 years ago. Okay, and then you got this medication 3 years ago. You've seen this doctor 2 years ago. All right, okay, this is moving very smoothly, because if you have so much information, so many symptoms, it's very easy to forget your timeline and your history, and you don't want to wait till the last second of the visit, say, oh, actually I have this symptom, but your doctor has already ran out of time during the visit, so you have to make another appointment in order to give your doctor more information. Or you don't want to forget and then leave the visit, and then your doctor actually gave you a diagnosis when in fact you have this other symptom, and it could totally change your diagnosis because of that one symptom. So you want to come prepared as much as possible. Don't be afraid to give your rheumatologist more information than they need, because you won't understand how complicated rheumatology can get. We literally investigate head to toe because our diagnoses can be so vast, and we have diseases that we have to rule out from other specialties as well. If you're taking supplements, bring that in as well, and whatever medications you have, don't be afraid to bring that in a bag to show to your rheumatologist. And if this is not your first rheumatology visit, if it's your second, third, or fourth, then it's important to also write out your symptoms between visits, because your diagnosis can always change. Your rheumatologist isn't perfect. This specialty is one of the more difficult specialties in medicine because it's like detective work. And if you are asked to get imaging or labs, please get them done ahead of time, preferably at least a week or so, because these labs can take time to come back. And also your medications. Always be honest with your rheumatologist and your doctors, because these medications, if you tell your doctor you're taking it, but you're actually not, it can really confuse your rheumatologist, because its symptoms can change, the diagnosis can change based on whether you're taking your medications or not. So always be honest. I don't get mad at my patients. I'm very empathetic in my practice because I have my own diagnosis, as you know, with arthritis. So I completely understand my patients when they don't want to take medications. And I work with my patients to get them comfortable whether or not they're taking medications or not. And if you find a study or you find stuff on the internet, don't be afraid to bring that up to your rheumatologist as well, because as doctors, we're always so busy. We're keeping up with so many different things. We're not always up to date on the literature. So don't be afraid to bring new studies, new information to your doctor. I'm sure they will appreciate it. At least I do. I appreciate it a lot when my patients bring me information that I'm not up to date on as well. So I hope you found this video helpful, whether it's your first rheumatology visit or if it's your second, third, or fourth follow-up. If you have found this video useful or you just like the information in general, please don't forget to like this video, comment below on what else you want me to talk about, and don't forget to subscribe and to support my channel. Thank you so much, and I'll see you next time.